Hello everyone, my name is Austin and today we'll be discussing clinical librarianship. So we will be covering a short history of how the position got its start, and then we'll move into giving the role its defining characteristics. After that, we'll be moving into some of the importances of the role. So let's begin. Okay, so first we're going to take a look at how this got its start. So the idea of the clinical medical librarian came about in 1971 and was introduced by Gertrude Lamb. The role was established first at the School of Medicine at the University of Missouri in Kansas City. Several years later, in 1974, Gertrude brought this concept to Hartford Hospital and the Health Center at the University of Connecticut. Lamb saw that there was a gap between the knowledge of the medical discipline about patient care and what information was actually being applied to the patient care. This gap was her driving force to create the concept and role of clinical medical librarians. The clinical librarian is a member of the patient care team for the medical facility that they're employed. This means that the librarian acts as an inpatient service and is available and present for daily rounds with providers and nurses, as well as any meetings that may concern patient care. Their role is to provide up-to-date and relevant materials concerning any clinical questions that the providers may have about cases and providing patient-appropriate materials to patients or loved ones. Essentially, a clinical librarian is a specialized reference librarian, as it is their job to provide information to positively influence the information-seeking behavior of the medical team and establish themselves as a valid team member. Having a clinical librarian on staff can increase the quality of care by providing appropriate materials to the care team. These searches can help influence or change diagnoses and/or treatments, which in turn can help reduce the readmission rates. Even though it is the librarian's role to provide this information, it's also a good idea for them to impart some improved information-based skills to other members of the care team, such as proper access and evaluation for these materials, as there can be times that the librarian themselves is busy dealing with other requests about other cases or patients and may not be able to aid with this particular situation right away. These librarians also provide patients with any information that could help them take care of themselves or their loved ones outside of the hospital. Again, the librarian can teach these individuals, the patients or family, where and how to look for information. And actually, if you take a look at the link on screen, that will lead to data collected by the Medical Librarian Association, and I recommend checking it out. I'll also have the link itself posted outside of the video, so it's easier to access. Thank you for joining me on this brief overview of clinical librarians. If you're considering going down this path and you haven't already taken a look around the Medical Librarian Association website, I recommend you do so. They offer a lot of resources as well as trainings and certificates that are very beneficial to any budding medical librarian out there. And it also wouldn't be a bad idea to register with them, especially if this is the field that you're trying to go down. Thank you again, and I hope you have a good day.